A new study looking at the effects of outdoor pollution finds that environmental factors can have an impact on overall cardiovascular health and mortality. The study, published in PLOS One, looked at multi-ethnic cohorts of over 50,000 participants, and they tracked how environmental exposures like smoke and dust affected cardiovascular outcomes. Researchers found that people exposed to high levels of outdoor air pollution were 17% more likely to die from heart disease and 20% more likely to die from other causes. The team determined that the burden of heart disease attributed to indoor and outdoor pollution was equivalent to the burden of cardiovascular disease linked to smoking tobacco. Well, joining us now to talk more about the effects of air pollution on your overall health is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here.
So let's start with what qualifies as outdoor and indoor air pollution, Dr. Raut.
Right. So looking from a global view, indoor air pollution is really caused by burning solid fuel sources like firewood, crop waste, and dung for cooking and heating. Burning of these types of fuels, especially in poorer households, is what results in the air pollution that leads to a lot of respiratory illnesses that cause premature death. So the WHO really looks at indoor air pollution as the single largest environmental health risk. We can compare that, though, with outdoor pollution. Common sources of outdoor air pollution are emissions, combustion processes from motor vehicles, and solid fuel burning and industry as well. Smoke from bushfires, wind-blown dust, and a lot of emissions from vegetation like pollen and mold spores all play a role here. Most commonly in the outdoors, we see things like nitrogen dioxide, carbon monoxide, and sulfur dioxide as well.
Well, from the sounds of this, Dr. Raut, we are surrounded with some sort of air pollution. Now, what really stood out to me in this study is that researchers say the combination of indoor and outdoor air pollution has the same risks toward cardiovascular health as smoking tobacco. So should Canadians be concerned about this?
I think we should look at the study and make our own concerns based on where we are. Now, most biomass fuels such as wood or dung without a chimney were 36% more likely to experience cardiovascular related death. Those who use kerosene fuel without a chimney were 19% more likely to experience cardiovascular mortality. So the question really is, are Canadians at risk for these statistics? An interesting Canadian statistic from StatCan is that 1 in 5 Canadians responded yes to burning wood indoors. So burning wood without a chimney or some area for the smoke to go is always a concern for cardiovascular and respiratory morbidities.
So what are some key things that people can look out for to identify if they're currently dealing with some sort of air pollution other than the burning of wood?
I mean, that's a great question. In Canada, we're lucky because the government of Canada does monitor and posts the Air Quality Health Index, which is basically a summary of local conditions, forecasts of wildfire smoke, and health risks and pollutants. The easiest way to look at that is basically just go to your browser and type in Air Quality Health Index and your location. And typically, you'll get a good summary of your local pollution levels and what you need to watch out for.
So how concerned should Canadians be, Dr. Raut? Should they consider potentially moving out of a region that has high air pollution levels?
So what we do know is in countries like Canada, we spend about 90% of our time indoors. So indoor air pollution is a bigger concern for us rather than a lot of the external environments. Having said that, things like indoor filtration and cleaning systems can make a huge impact there. And if you do spend the majority of your time outdoors, yes, there is that increased risk of outdoor air pollution. And yes, in that degree, maybe the higher risk for you would be better off with a relocation from a hazardous environment. But for most people, I think looking at other approaches would be better.
All right, Dr. Raut, we've got about a minute left here, but let's switch gears to smoking itself. We know there are a lot of risks associated with smoking cigarette products, but we're seeing a rise in vaping products. So what kind of dangers are associated with vaping, Dr. Raut?
Right. So what we do know is that vaping is less harmful than smoking, but it's not safe. Regular tobacco cigarettes can contain almost 7,000 different chemicals, most of which are toxic. There's no doubt that vaping exposes you to far less toxic chemicals. However, having said that, there has been outbreaks of lung injuries and deaths with vaping. In 2020, the CDC had confirmed almost 3,000 cases of e-cigarette vaping-induced lung injury, or EVALI, and almost 68 deaths associated with that. Research is also showing that vaping is bad for your heart and lungs because nicotine is still a toxic substance. And then finally, what we do know is electronic cigarettes, by using nicotine, is still just as addictive as regular cigarettes and as other chemicals such as heroin or cocaine.
All right, Dr. Raut, thank you again for another informative interview.
Okay, thanks so much.
We'll be right back.